All right, it may not be something you think about, or you may not even heard of this, but head and neck cancers are becoming more common. So what are they and how can they be screened for treatment? Joining me now is Dr. Jeffrey Lehman, an ENT specialist at Winter Park Memorial Hospital and the Florida Hospital Cancer Institute. Thank you so much for joining us this morning.
My pleasure.
When we were preparing for this segment, a lot of people didn't even realize what a head and neck cancer is. So describe it to us.
Well, traditionally defined head and neck cancers are cancers of the mouth, throat, voice box, nose and sinuses, or the salivary glands. And when you look at that definition, it's 3% of all cancers. But head and neck cancer also can include thyroid cancers, as well as skin cancers in the head and neck area. Those are cancers that we deal with in my specialty. And when you include those cancers, it's a very common site of cancer occurrence.
When you have pain in your throat or any of the places that you just mentioned, what would prompt you to say, okay, I need to go to the doctor because this could be more serious than just a normal infection?
Basically, persistence is something is present for more than 2 weeks, particularly if it's affecting swallowing, voice function, or some other function, or if it's associated with a lump in the neck or something different that you can feel or see inside the mouth or throat. Those would be things that you'd want to have checked out.
Okay, is this something that is on the rise in our area?
Well, thyroid cancer is on the rise, particularly in women. Thyroid cancer is twice as common now as it was in the 1970s. Skin cancer seems to be on the rise as well, although the head and neck cancer in the mouth and throat area in absolute terms is not on the rise. It's now affecting a younger group of patients. We're seeing people who have not been in the usual risk group of smokers coming in with cancers associated with HPV or human papilloma virus.
And what is the connection there?
Well, human papilloma virus can cause growths in the mouth and throat area as it can in other areas of the body, and these growths can undergo malignant degeneration over time.
Okay, and what does that mean for the person?
That means that it can turn to cancer.
Okay. All right, so when you're facing these issues, what is the type of treatment that you would do? Well,
traditionally, treatment has involved trying to remove the whole cancer with a rim of normal tissue around it when we're looking at surgical options. And in the past, that involved big operations, external incisions, and a lot of functional problems, difficulties swallowing, so forth. The pendulum then swung over to using chemotherapy and radiation therapy to try to treat these things in order to try to preserve function and avoid the big incisions and all. The problem with that is that long-term, a lot of people can have issues with swallowing and other functional concerns with radiation and chemotherapy. Most recently, we're seeing a trend towards minimally invasive surgery, and one of the real exciting areas there is robotic surgery. We're using the transoral robotic technique to get access into these very tight areas of anatomy, be able to see and work in there in a similar way that we could with big open procedures, but without the incisions and the long-term functional issues with swallowing, speaking, etc.
So, I mean, what would happen after that point? So if you are having such improvements with robotic surgery, what happens after you get that surgery? Are you able to recover and eat again as normally people would?
Yeah, as opposed to the older techniques of surgery where people would spend weeks in the hospital with robotic techniques, they can typically go home a day or two after surgery. Swallowing function is usually rapidly recovered afterwards. Sometimes they'll still need additional radiation therapy after their robotic surgery, but we can de-intensify that. They need a lot lower dose, and that translates into much better function long term.
Okay, Dr. Lehman, thank you so much for joining us. And you know, he's going to be available to you. He's going to be joining our web center, answering all of your questions this morning. So if you do have a question about anything regarding head and neck cancers, just go to our website, myfoxorlando.com. You're going to click on the top stories and then join the web chat there. So why don't you go ahead and get set up in our newsroom? We'll meet you back there in about a half hour.
Very good.
All right, thank you, Dr. Lehman. The newsroom right now with our Dr. Jeffrey Lehman, an ENT specialist with Florida Hospital, answering your questions about ENT head and neck cancer. So what is the most interesting question you've gotten thus far?
Well, I had an interesting question from a woman whose father has tonsil cancer. The cancer is not really responding well to radiation. She was wondering where robotic surgery was available in the Central Florida area, whether it was available at Shands or not. Yeah, at this point, it's not available at Shands Hospital. They're not doing transoral robotic surgery. We do offer it here in Orlando at Florida Hospital Orlando, as well as Winter Park Hospital.
And I also noticed that people were asking you what types of lumps they should be concerned about.
Yeah, basically a lump that's been present for a few weeks, particularly particularly if it's painless, if it's hard, if it doesn't move very much. Those are lumps that should be checked out.
Okay, what other questions are people giving you right now? Because you've been typing away for quite some time.
Yeah, questions about sore throats, whether those are things to worry about. Again, the rule is anything over 2 weeks or anything that seems to be progressively worse, you probably should have that checked out. Questions about other things, headaches, jaw pain, ringing in the ears, a whole range of issues.
And what are the questions regarding the headaches? Because that's something that's very common, and I just think that people never know, is this just a headache if it lasts for an extended duration of time?
Yeah, most headaches, if you can explain it based on stress, if it comes and goes, responds well to pain medications, probably not something to worry about too much. A headache that wakes you up, a headache that's not responding to pain medications, something that's associated with any other neurologic symptoms, blurring of the vision, something unusual, that's something that probably should be checked out.
All right, Dr. Jeffrey Lehman, thank you so much for being here, and you're going to be doing some more questions for another 5 minutes or so, right?
All right, very good.
All right, thank you so much, appreciate it. Now let's go ahead and talk to Amy.